Rotarians and guests, welcome to the September 9th meeting of the Rotary Club of York. We are the 23rd largest Rotary Club in the world. Leading us today in our song and pledge is Aaron Jacobs, and delivering our invocation is Eric Chase. Aaron.
Thank you, President Ann. Rotarians, my country 'tis of thee, sweet land of liberty, of thee I sing. Land where my fathers died, land of the pilgrim's pride, from every mountainside let freedom ring. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Eric.
Thank you, Aaron. Thank you, President Ann. If you would prepare yourself for prayer in the way you're most accustomed, let us pray. It is a call to listen more than we speak, to remain calm even when others are in chaos, to stay clear and focused even when no clear direction is apparent, to value people exactly as they are and not as we think they should be, and to be with people who are suffering rather than trying to have all the answers. And so we pray, good and gracious God, that you are the source of all healing in our life. If you have, we ask you to share this wonderful ministry we call Healing Presence. Today we pray for those who care for others, like the team at SpiriTrust Lutheran. May your grace move through each of them to reveal your healing touch, your compassionate glance, your consoling words. Bless them in a special way and strengthen them so that they may continue to be your healing presence to others. We pray for healing in our world, in our country, in our communities, and in our Rotary Club. May we be strengthened today to place others before ourselves as we continue to serve you. And it's in your name we pray. Amen.
Amen. Thank you, Aaron and Eric. We have several announcements today. Our deepest sympathy to Rotarian Jennifer Gutner May on the passing of her father, Joseph Newton Gutner, on August 24th. Services were held on August 29th, and a celebration of his life will be held in the future. If you wish to make a memorial donation in his name to one of the club's endowment funds, please contact Bert. Our membership committee meets today at 1 o'clock via Zoom, and tomorrow the Rotary Board meets tomorrow via Zoom at 8 a.m. District 7390 is hosting a seminar about Club Runner. Now this is on Monday at 7 p.m., so that would conflict with those of you that are planning to partake of the festivities with our annual fundraiser Monday evening, but it will be available online on the district website to view later. Preserve Planet Earth Committee is requesting volunteers for the York City Trash-a-thon. This is on Saturday, September 19th at 8 a.m. The main location is East Princess and Broad Street, but there are several other check-in locations. A continental breakfast and a grab-and-go lunch will be served for all volunteers. And you can reach out to Aaron or Austin. Their information is on the screen if you'd like to volunteer or have questions. Also, we kindly appreciate your suggestions and ideas for program speakers. Send those to past President Mike Summers, and his email is on the screen for you as well. Next, we welcome Bernice to the virtual Rotary podium for a fundraising announcement and auction kickoff. Bernice.
Thank you, Ann, and good afternoon, fellow Rotarians. After many hours throughout these past few weeks and months, I am over the top excited to announce our virtual auction is now live and ready for bidding. We encourage everyone to get on and look around the site, send the link to their friends and families to participate, and also drive and ramp up those bids as much as possible. I'd like to give a huge shout out to Ken Cooper for all of his help with making this happen, along with Jane Schussler's daughter, Jenny, for mentoring us through this process, as well as Jane herself, Jackie Summers, and Dee Baker for everything they did. So couldn't have done this without all of you. I hope you saw Bert's email that went out yesterday, and I'm going to do a run through based off of that. I just want everybody to get familiar with the unknown and feel comfortable in doing this. So hold on a second. There we go. The unknown's a little scary, so I just want you to see what you'll be looking at when you jump onto that link, and that would be the link that you would send out to your friends and family as well. So when you're on here, you will see as you scroll down all the different auction items. Now I'm already logged in, but I'll show you where you would go to do so if you did not already create an account. So as you look at all of these, and I will click on the necklace just to show an example here. It will tell you the description over here. Here's the photo of the item, the starting bid, the bid increment, which is really important. And you can either be anonymous or you can share your name of, who's bidding. And then right here is where you place your bid. So if I did not have an account already, right here is right where the location would be for log in or join now. And then you would fill in your information. All you would need is your name, phone number, and address. All of the items are not closed out until the end of the auction. So when you hit submit bid, then you're in the running. And then everything is not closed until Monday, the 14th at 7:30. So happy bidding from here on out. The only item that you actually will have to pay for ahead of time will be the donate to the fundraiser. So if you just want to go and place a donation, you don't need any more stuff or an experience or anything like that. You just click on here, and then that's when you would close that out then. So you would bid any amount that you would like. So it seems very simple as you're going through it, but we do know that it is a different world nowadays, and we want to make this the best event possible. So I will be available behind the help all day of the event. It'll be next to the registration. I want everybody to feel comfortable, and we'll have all hands on deck to help with this. It's really important that we make this a huge success, but we work together as a team, as a club all together. So I hope that we can all rally behind one another. And just happy bidding, everybody. Thank you so much.
Thank you, Bernice. Thank you to Jane, Jane's daughter, Ken, Jackie, and all. It sounds like a fantastic team working on the auction, and good luck to all the bidders. I'd like to read this statement to everyone. This is from Rotary International. At Rotary, we have no tolerance for racism. Promoting respect, celebrating diversity, demanding ethical leadership, and working tirelessly to advance peace are central tenets of our work. We have more work to do to create more just, open, and welcoming communities for all people. We know there are no easy fixes, and that challenging conversations and work lie before all of us. Rotary's strength has long been our ability and commitment to bringing people together. We will tap into that strength now as we stand with those who are working for peace and justice. Rotary will do our part to listen, learn, and take action to ensure we continue to contribute to making positive change. Friends, promoting equity, increasing diversity, and ensuring inclusion are significant ongoing challenges. Hey, Ben, could you back that slide up, please, to the Rotary statement? Thank you. Thanks, Ben. Promoting equity, increasing diversity, and ensuring inclusion are significant ongoing challenges for many organizations in York and across the country. Yesterday, a brain trust of Rotary members gathered to advance our club's diversity, equity, inclusion, or DEI journey. We reviewed this statement on your screen from Rotary International. Rotary took on a big, hairy, audacious goal to rid the world of polio. Now our club, our entire Rotary community, has an opportunity to lead the way and lay out a strategy for Rotary to become a shining example for others and to collaborate with those who advocate against racism, a problem plaguing our society. Rotarians are people of action, and yesterday, the Rotary Club of York thought leaders created two significant actions. One action will be on our board agenda tomorrow morning. including a discussion and vote to create a Rotary Club of York DEI task force. The official name will be determined, but I think pretty strongly the vibe was it will not contain the word committee. If you're interested in serving on our club's DEI task force, please share your interest with Jackie, Glenn Miller, or me, and your consideration is appreciated. The second action, now Ben, to the next slide, please. Thanks for all your help, Ben, is we agreed to invest in a trailblazing racism and diversity expert, Jane Elliott, that's coming to York. Thank you for the Parliament organization for partnering with the Pennsylvania Human Relations Commission to host Jane Elliott. Now, I do want to let you know, again, this is the second event we've announced that is conflicting with our big fundraiser, important fundraiser Monday evening. The important part to remember about this is we will have the recording. We will be able to share a link with everyone in our announcer, on our website and our Facebook. So if you're planning to attend the dinner Monday night, enjoy that, and you can catch up with Jane Elliott's excellent work. So we are supporting this with a $1,000 sponsorship, and I know that there are many organizations and businesses in our Rotary community that are also supporting this. So thank you very much. And next, we have a local biz spotlight featuring RKL. RKL is now the largest CPA firm based in Pennsylvania and the 57th largest in the country, with 6 offices in Pennsylvania. Since mid-March, RKL team members have been working remotely with office visits by appointment only. Team members have stayed connected through various community efforts, as well as virtual happy hours and virtual trivia contests over the past 5 months. The RKL webpage on the pandemic, as well as the regular webinar series, has provided extremely valuable information and insight to their clients and prospects, with a number of the webinars in April having well over 1,000 participants. RKL is extremely proud of Hunter Mink, the immediate past president of the Rotary Club of York East and the current chair of this year's United Way of York County campaign. Hunter is the first RKL team member to serve in this role and the first for the office since Rotary and Don Dellinger served in the role a few decades ago. I would like to give a shout out to all RKL employees for living united, supporting our community, and also to Doug Dohrman. A few months ago, we reached out, the leadership team, Josh and Jackie and I, and asked Doug if he would fill the big shoes of Steve Klunk, who was our treasurer for the past decade. And through that conversation, we learned that Doug had been president of the East York Rotary Club and treasurer for many years. So Doug, we very much appreciate your service above self to our club. Thank you. And now to introduce our program is Glenn Miller. And I'd just like to give a reminder to everyone, please utilize the GoToWebinar bar on the right of your screen to submit questions that we'll consider for Angela. You can do that at any time. Thank you. Glenn.
Thank you, President Ann. It's a genuine pleasure to introduce my former colleague and my dear friend, Angela Dohrman, who is Senior Vice President of SpiriTrust Lutheran here in York, who's graciously agreed to join us today to speak on arguably one of the most critical aspects of the COVID-19 crisis, skilled care nursing facilities and personal care. Angela and I have known each other for nearly a decade, 7 of those years as colleagues and all of those years as friends. In fact, we lived on the same street, we worked in the same office, and we were born on the exact same day, though she was born a couple of hours earlier than me, which I never fail to continue to remind her of. More important for our purposes today, Angela continues to serve seniors faithfully in our community. We serve together as senior staff at SpiriTrust, where, among other things, she oversees 6 continuing care retirement communities that includes 5 skilled care units. In my personal and professional life, I have never known anyone with a deeper, more abiding passion for seniors and the issues they face as they age. Angela's professional life has been committed to ensuring that our oldest citizens can age with grace, dignity, and perhaps most important, the services and care that they need and deserve. Never in my lifetime, at least, has carrying out that commitment been more difficult with the advent of COVID-19, which has hit our seniors, including those in skilled care facilities, with a vengeance. I know on a very personal level what these months have been like for my dear friend and for her staff at SpiriTrust. And I am again very grateful that she's agreed to take the time to talk to us today. Due to some technical difficulties, she will be joining us by voice, but unfortunately not by video. Rotarians, please join me in giving a warm virtual welcome to Angela Dohrman.
Thank you, Glenn. It is an absolute privilege for me to be your friend, and I'm grateful for that introduction. And good afternoon, Rotarians. I am grateful to be presenting to you today as well. I apologize for the technical difficulties, but I have to tell you that Ben Ott is an amazing person and has been working diligently to assist with that. So I join you today by phone. I know that some of you know me, many of you do not. I feel certain that most of you are likely to recognize SpiriTrust Lutheran. SpiriTrust Lutheran, of course, provides residential living, assisted living, personal care, memory support, and nursing and rehabilitation services in 6 life plan or continuing care communities throughout central Pennsylvania. We have a home care agency. We have a non-medical care agency. We provide hospice services and palliative care in the community. We have 2 life programs, which is an innovative program for clinically frail adults in need of nursing home level of care. We provide counseling service, financial education. We work in domestic abuse solutions, volunteer income tax assistance, and an array of other programs. We typically serve about 23,000 people in 16 counties in Pennsylvania and 3 in Northern Maryland. And our corporate offices are very fortunate and grateful to be right here in York on Pennsylvania Avenue. I've been with SpiriTrust for about 12 and a half years now. And while that's remarkable to me, even more remarkable is that I'm starting year 40 of a very long, sometimes very demanding, but always incredibly rewarding career in long-term care. I personally believe it is a calling for me. There is no higher honor than working in service to this country's oldest and most vulnerable citizens. Throughout my career, I've worked mostly, except for a short period of time, in mission-focused, faith-based, not-for-profit organization in a variety of roles. I actually started while I was in college working as a nursing assistant and a nursing home housekeeper. I've been a social worker, nursing home administrator, executive director of a large senior living community, a regional vice president of operations, and now have the pleasure of being the senior vice president and COO at SpiriTrust. My point in sharing all of that with you is to let you know that I have seen a lot in my career and for many different positions within an organization. And we are indeed, as many people say, in unprecedented times. You know, one of the great gifts of working with older adults is learning their stories, gleaning their advice for how to live life and navigate one of the most challenging times of life, old age. And so just for a moment, I'd like to take you back to my days as a nursing home social worker. The year was about 1985. I wish I could share a picture with you. I had massive hair. It was the 80s, of course, and I was in my 20s. I remember being on a team of people who took care of a woman who was 105 years old. The stores of wisdom and memories of someone who has had such a long life is indeed a treasure, and I was privileged to be part of her care team. This woman was an Army veteran who had served as a registered nurse during World War I. She shared amazing history with me. I remember in particular one day as she was talking, she became very somber. Her voice was almost a whisper as she recounted her days in the Army, coming home from France to be stationed in a makeshift Army hospital in New York City. She described the setting as long rows of massive amounts of cots within a large airport hangar. Her patients, mostly young soldiers who had survived the war only to come home to die from the flu. The year was 1918, and the flu epidemic was on its way to claiming 675,000 American lives. The war claimed around 116,000 American lives, the majority of those deaths from disease, not combat, most of the deaths from the flu. I can still hear this woman saying to me with tears in her eyes, "I hope you never see anything like that in your lifetime." It was still haunting her almost 70 years later. And now, 35 years later in my career, here we are faced with another global pandemic. Since early March, those of us who've worked in long-term care, nursing homes, personal care, assisted living, have been running a race. We liken it to a marathon being run at a sprinter's pace. We are running this race to prevent deaths of older adults in these settings. On the front lines, we have been battling the most insidious of viruses, COVID-19 coronavirus. In nursing homes, this virus stalks silently, attacks quickly, and is intent on finding victims. We are literally working around the clock to protect and save lives. I checked, and today the number of COVID-19 cases in the US is around 6.3 million, with almost 190,000 deaths. Most of those deaths are among those ages 66 to 84. This is an age group that is most likely to be living in a nursing home or personal care assisted living setting. In early March, there were warnings that those in nursing homes were particularly at risk for COVID-19. From the earliest cases on the West Coast, the spread in nursing homes began. It was obvious as a country we were caught off guard by the speed and the viciousness of the virus. The insidiousness of how it traveled, the asymptomatic carrier, was not yet fully realized or accepted. When the virus hit New York City, the eyes of the press and the country went there. The pictures out of those New York City hospitals were unbelievable. The fear was intense. Unfortunately for nursing homes, the attention and response was not yet in focus. We began receiving guidance from the CDC, the Center for Medicare and Medicaid Services, CMS, the federal agency with oversight of nursing homes, the Pennsylvania Department of Health, the Pennsylvania Department of Human Services. This guidance literally flew out daily, seemingly sometimes by the hour, from these agencies. This effort, although well-intended, was not anywhere near a coordinated response. In the early days of the pandemic, our command team spent so much of our time reading guidance from everywhere, trying to interpret it, trying to operationalize it, and implement it. The guidance kept changing. The evidence, though, became more and more clear. Restricting access to residents in nursing homes could save their lives. I remember one of our earliest decisions and one of my hardest decisions was restricting the visits of spouses. Imagine for a moment being married for 60 or 70 or even 75 years and suddenly not being able to visit your wife or husband. Heartbreaking, but perhaps life-saving. In a very short amount of time in those earliest weeks, we rapidly closed our nursing homes, the assisted living centers, and personal care facilities. We also closed the residential living areas of our communities to the outside world. We secured our low-income housing apartment buildings. We placed all of our team members in personal protective equipment, PPE, our residents in masks. We restricted non-essential staff, started screening all team members at the start and end of each shift for signs and symptoms of COVID. We tracked their travel to see if they were going into hot areas for COVID. We discontinued resident activities, dining room meals. We instituted severe infection control standards. We dealt with every range of emotional response from families, residents, and staff that you could ever imagine. We were worried, just like every other health provider in the country, about sustaining adequate PPE levels and the ongoing ability to source the necessary masks, gowns, and gloves to protect our residents and staff. Staffing levels, always a major concern in nursing facilities. There just are simply not enough people to fill available positions. Became an even greater concern. What would happen if we had positive team members? How would we staff? We did so much scenario planning in the early weeks. One of my most asked questions of our team, and one that they came to expect, was, yes, if we do that, okay, but what if? SpiriTrust Lutheran made a very important commitment in those early days to full transparency, operating from our core values of integrity and service. We developed a robust communication plan to ensure residents, families, and our staff would know exactly what was transpiring in our community. We planned an aggressive attack to keep COVID out of the buildings. The early weeks turned into months, and it became apparent that a coordinated national response to ongoing outbreaks in nursing homes was critical. Providers were in desperate need of rapid testing to identify asymptomatic carriers. We needed PPE, we needed staffing support, and we needed ongoing funding to assist in dealing with the extraordinary costs of our response. It's important to me that you understand that my next remarks are not intended in any way to be political, but they are reflective of the reality faced by long-term care providers throughout the last 6 months. There have been both successes and failures at both the federal and state level to protect our residents. The successes, there was almost an immediate response to waiving certain regulations to allow us to move quickly to protect residents. There have been funds distributed from both the federal and state level, albeit not nearly enough to cover COVID-related costs. The major challenge has been a lack of comprehensive and coordinated response to our most critical needs, PPE and testing. I share that at one point we were to receive PPE from the federal government. We did. We received cloth masks, not surgical, and latex gloves. We haven't used latex gloves for years due to severe allergic reactions. Our state and national associations for not-for-profit providers, Leading Age and Leading Age PA, have been advocating for months on our behalf for help with testing. Testing is vital to quickly identify possible asymptomatic carriers to prevent the spread of this virus. Staff can unwittingly be a major threat to our residents by coming to work without realizing they are a carrier. Yet tests have not been immediately accessible or affordable. We have experienced delays of up to 2 weeks to receive test results, and the cost of testing is extraordinary. A conservative estimate by Leading Age National indicates that testing staff one time per week in a 200-employee nursing home facility is $160,000 per month. Last evening, I was on a CMS call as they explained how they're finally in the process of distributing rapid tests to the country's nursing homes. At present, SpiriTrust has received 1 test machine and 11 test kits for 344 skilled care beds and over 800 employees. We are anxiously awaiting the rest of our shipment. We are to receive enough kits for 1 round of resident tests and 2 rounds of staff tests. After that, we will need to purchase our ongoing supplies. We do have mandates from both CMS and state agencies for COVID testing of residents and staff. It's important, again, to note, especially as community leaders, that the federal rules for frequency of testing are based on county prevalence due to the potential impact of staff exposures. We are observing an uptick in prevalence rates where we have communities. As the outside world continues to reopen businesses, celebrate holiday weekends, debate mask mandates, and tries to resume some semblance of normal life. For nursing home residents and personal care and assisted living residents, it is critical that community prevalence remain low, as our staff do want and need to go home after their shifts. They need to grocery shop, take care of their families, prepare to send their kids to school, and they need to safely move about their community. When community prevalence is high, it unfortunately increases their risk of exposure and bringing the virus to residents. I have to say that I'm grateful to the York County Commissioners, Julie Wheeler as the President Commissioner, for an oftentimes thoughtful and measured, considerate approach to the COVID response in York County. Never an easy job when you have so many stakeholders or bosses, as the case may be, but never more important than now. We have also received great guidance and support from the York County Office of Emergency Management. They have been an absolute asset to us. I have to lift up Bill James, Sean Page, and Laura Silver. They are there immediately. They answer our calls, our text messages, providing guidance and direction. But I cannot stress this enough. Personal behaviors do matter. In the outside community, personal behaviors matter. As we work to keep COVID out of nursing homes, personal care, and assisted living communities, as we work to continue to protect the most frail and vulnerable older adults, masking, social distancing, and effective hand washing are critical. To manage this ongoing crisis, providers such as SpiriTrust need good partners to clinically and medically manage all of the concerns inside our centers. At SpiriTrust Lutheran, we are so fortunate to have excellent medical directors in all of our skilled care centers. In our York County facilities, that is Dr. Ina Kaplan of WellSpan. I know Dr. Kaplan well because she took care of my dad for a number of years as he continued to decline and eventually die from dementia. In my heart of hearts, Dr. Kaplan is a rock star, and she has been with us every step of the way throughout this pandemic response. We're grateful to her and our other medical directors in the other counties. We're also grateful as a partner of the post-acute network with WellSpan for their support to their post-acute partners during this time. It really does take good, solid partnerships to move forward and navigate this pandemic. But in an effort to bring my remarks to a close today and to answer any questions that I can for you, I want to say that I've spoken a lot about what our command team at SpiriTrust has done and continues to do. I spoke about the government response to this pandemic. I've spoken about our medical partners, but I need to lift up the true heroes of the daily work to keep our older adults safe. And that's the frontline team members working in our nursing homes, assisted living, and personal care facilities. Nurses, nursing assistants, housekeepers, laundry staff, dining staff, chaplains, facility staff, the leadership of our life plan community. These are the true champions of this story. I know oftentimes that the heroes of healthcare are often reflected on the news as working in hospitals, but they are in nursing homes and these congregate care settings as well. Every day, these folks put on a massive amount of PPE to an uncomfortable level. They walk into the unknown and do whatever it takes to keep the most vulnerable members of our county safe. With imposed isolation, these team members are even more critical to the well-being of our residents. They are not only physical caregivers, but emotional caregivers as well. They subject themselves to repeated COVID testing as they manage the extraordinary daily demands created by our pandemic response. As I've said, they're the true heroes and champions of this story. If you know them, please remember to thank them. So in conclusion, I think maybe one day I might be in the nursing facility. I don't know that I'll be 105 years old, but hopefully I will be gifted with a long life. And I may be telling this story to a young social worker. And I pray that our story as a nation, as a state, as a county, as healthcare providers, that our story turns out well. So I'm available to answer any questions that you may have for me today.
Angela, thank you so much for joining us today, and thank you also to you and Ben for navigating some of the IT challenges that faced us today. We really appreciate the work that you and your colleagues at SpiriTrust Lutheran are doing. I have a question for you. What percent of COVID deaths in Pennsylvania were traced to nursing facilities in Pennsylvania and then also nationally?
That's a good question, Anne, and I don't have those statistics with me right now. I can look them up and get them to you, but suffice to say that the number of deaths have been extraordinary.
Mm-hmm. Mm-hmm. Well, thank you for reminding us of the risks that your frontline team members and staff are putting themselves and their families in to keep our seniors and vulnerable populations healthy. They certainly are, as you said, the heroes and the champions. No other questions at this point in time. So Rotarians, just as I said, here comes one. Is there, Angela, a safe way to see video through windows of friends or family members?
So if I understand the question correctly, is there a safe way to visit through the window? Is that correct?
Mm-hmm. Yes, in your facilities.
Sure. So the reopening of the nursing homes and personal care assisted living facilities are being guided by the Pennsylvania Department of Health and the Department of Human Services for the personal care and assisted living communities. And so it's a very, very thoughtful, it's a very intentional process that they have laid out to keep people safe. Again, it's very much based around monitoring community prevalence and reacting to that. And so we have done some reopening in areas where we feel it's safe. We have allowed window visitation in campuses, in communities where we will establish a time with a family member to come and meet their loved one through a window visit. We do have in-person visits right now occurring at 2 of our communities. And again, they are structured very carefully, very safely. They are outside only. The family and the resident must maintain social distancing. They must be masked, both the resident and the family. So we are working so very hard to, again, reconnect folks with their family members. This is one of the greatest tragedies of this virus, is the isolation of older adults. And so, again, as we work and to, continue to lift the lid on reopening, I always say with our team, we want to prioritize family visitation.
Thank you, Angela. This question is from one of the educators who is a member of our Rotary Club and probably likely dealing with boosting morale of our youngest children in our community at this time. So the question is, what are some things or events you hold in your facilities to boost morale with our seniors during these troubling times?
That is a great question, and I am grateful for that question. We, in the early days of the pandemic, one of the things that we had to do was restrict all non-essential team members from being in the care areas. So that meant that our activity, our life enrichment teams were prohibited from going back. We did, as a faith-based organization, identify that a chaplain was an essential team member. So they were continuing to serve residents. And we also, again, had to restrict the dining team members. And if you've never been in a community, in a nursing home, assisted living, personal care, and observed on a regular basis the family-like atmosphere that occurs between the staff and the residents, it is really an amazing, amazing thing to see. And so literally these folks are even more important as their family members, as the residents' family members, as we continue to provide care. And so they do special things. We have computer screens that we take to residents' rooms. We do set up video visits with family members and friends. There is a way to play apparently non-contact games that residents can play from their room with a team member. And a lot of it is just trying to be there and listen and provide that special care that can only come from that relationship between the caregiver and the resident right now. So our chaplains are critical. Our social workers we identified as critical team members, or I should say essential team members, and they have a very, very important role right now. As we begin to lift again and reopen in some of our communities, we have reintroduced some other opportunities for residents that we will, again, go very slow to go fast. And there's also some new guidance that just came out from the Department of Health about the utilization of family members for compassionate care in skilled nursing facilities. We're awaiting some further direction from the Department of Health so we can, again, assess and identify how we could utilize family members in that role. But a great question, and thanks for asking it.
Thank you, Angela. This question has to deal with the challenges that the pandemic and COVID and the regulations may be placing upon you with maintaining your staffing levels and really also morale amongst your staff. So could you address that, please?
Sure, and that is a question, a great question, I should say. It is probably our greatest challenge. I am involved in conversations and meetings, conferences on a regular basis around how we do this. So anytime there is an asymptomatic test, a positive test of a team member, of course, they cannot work. Anytime a team member develops any COVID-related symptoms, we sit them out and try to get them a test, a rapid test. We are very, very fastidious about screening our team members at the beginning of each shift for COVID symptoms, and also, again, where they travel and have they maintained social distancing? Did they wear a mask in public settings? All things that put people at risk for developing COVID-19. So we really screen people carefully, and as a result, we, operating from an abundance of caution, sit people out. And so we've had to be creative. We have had to rely upon some of our administrative clinical team members to fill shifts and work shifts and provide care. One of the successes that came out of, and again, I cannot remember at this particular moment if it was the federal government or the state government, but that there are certain team members that could be, with some rapid education and some training, become certified nursing assistants. They did not have to go through the lengthy course that it takes to become a nursing assistant. And so we have had a lot of team members step up into that training and to become nursing assistants. So we have also reached out to the state and always told them where we stand with staffing concerns, because of, again, not wanting to get into a crisis where there is no one on the next shift to take care of people. So it is probably, from a command team level, something that we spend a lot of our days on. And we will continue to have to do this as we move through the pandemic.
Thank you for sharing the challenges that you and your staff are facing every day, Angela. We did receive a question from a Rotarian wanting to know if you can share how many deaths due to the virus that you've had throughout the SpiriTrust organization so far.
Sure, I can. And just so you know, again, SpiriTrust is always very transparent about our results, and they are posted on our website. We have had, in the early days, we had an outbreak in one of our low-income housing apartment complexes, and one of those individuals did unfortunately die from COVID-19.
Wow. Out of how many folks are under your care totally?
Gosh, and in the senior living, the life plan service line, there's probably right now between 12 and 1,300 folks.
That's impressive, Angela. Thank you for joining us today. Thank you for sharing an insight in the very important work that you do for our community and the footprint of SpiriTrust. Thank you for sharing that the commissioners have been very helpful in their response. Commissioner Julie Wheeler, President Commissioner Wheeler, is a member of our Rotary Club, and we're glad to hear that the York County Office of Emergency Management has also been very responsive to you. And I'm just one of about 300 members of our club, but I have been in and out of your facilities for the last 3 decades. My grandparents, both sides, my great aunt, and now my mother is in the BJE at Shrewsbury. So we've been in the apartments, in the cottages, in Zimmerman Place, and I can say that your staff is just amazing. And I miss seeing them as well as seeing my mother, but thank you. It's been a real pleasure to be able to have window visits with her and in-person visits. So please share our thanks and appreciation to all of your team for keeping our family, our community safe. And I did want to reinforce a statement you made earlier about personal behaviors matter, because your staff have to go out in the community, to the grocery store to when they leave. So thank you to everyone for wearing a mask to help keep those frontline workers and those champions in our community, whether they're dealing with child care or adult care, to keep them safe. So Angela, thank you again for your amazing work at SpiriTrust.
You're very welcome.
We do have a book in honor of you today that will be, we'll ask you to sign a nameplate, and that is Play Day School Day. That will be presented to the Child Care Center at the York Jewish Community Center. Thank you, Angela. And Rotarians and guests, I'd like to give you a sneak peek at our speaker for next week. It will be Jane Dyer from the Rotary Club of Greenville, North Carolina. Jane was the only female pilot in the Air Force pilot training class in 1981. She learned firsthand what it meant to be unwanted and unwelcome because she was different. Since then, she has made every effort to intentionally be inclusive. Rotary is a worldwide organization binding people of all colors, faiths, genders, nationalities, ethnicities, and beliefs. The success of Rotary is in inclusion. However, our club, like many, struggle to reach out to people who are different than we are. A little over a year ago, Jane and her club tried something different. They intentionally invited members of their community to join them for a diversity breakfast to learn more about Rotary. Please join us next week, and we'll hear more from Jane. I hope you have a wonderful day and a fantastic week. Our closing song today is Remedy by the Black Crowes.